Individual assessment for behavioral symptoms. The Federal Nursing Home Reform Law, passed in 1987, is part of the Social Security Act. It protects each nursing home resident and requires that nursing homes provide service and activities to attain or maintain the highest practicable physical, mental, and psychosocial well-being of each resident in accordance with a written plan of care. What this means is that each resident's individualized needs must be discovered and addressed. The nursing home must carefully and thoroughly assess each resident in order to meet his or her needs. Many things should be taken into account. A partial list follows: life history, daily routine, strengths, interests, food preferences, and other personal information. Functional abilities, including walking, dressing, using the toilet, and eating. Physical or mental conditions that affect a resident. Potential for improvement. Communication abilities, nutritional status, and medications. A thorough assessment is vital to knowing the resident so staff can care for him or her in a manner that enhances his or her quality of life. The assessment must be completed within 14 days of admission into the home or 7 days for Medicare residents. Thereafter, an annual assessment must take place or be conducted if the resident's condition changes. After the assessment is completed, the information is analyzed and a care plan is developed to address all the needs and concerns of the resident. An interdisciplinary team, nurse aide, activities and dietary staff, social worker, with critical input from the resident and or family members, should work together at a care plan conference to make certain that all medical and non-medical issues are agreed upon and addressed. Resident and family member concerns should be listened to and addressed in the care plan. A good care planning session takes time. It should not be rushed and could take at least 1 hour. Every 90 days after development of the initial plan, a care plan conference is held to determine how things are going and if changes need to be made. The assessment and care plan should emphasize 2 main points: the uniqueness of each resident and the staff's responsibility in meeting each individual resident's needs. With these points as the focus, the question can be framed: what does the behavior symptoms mean? What are the unmet needs? And how can staff help him or her? Use why, when, where, and how questions to help staff think of as many reasons for the behavior as possible. Keep the focus on the needs of the resident. Know your rights under the law. Residents cannot be forced to leave the home without specific notice and appeal rights. Physical restraints cannot be used to treat symptoms. Treatable by individualized care. Monitor implementation of the care plan and address lack of implementation immediately. Work closely with aides and professional nurses to orient them to the resident. Make sure the resident's doctor is aware of and supportive of the resident's care plan. Request outside consultation from the ombudsman if necessary.